Hey, what's up, Mama?
What's a Circle of Willis?
Okay, so the Circle of Willis is a network of blood vessels, of arteries at the base of the brain, right? And they're receiving their blood supply from the internal carotid arteries. And so there's like an anterior artery, there's an anterior communication. So like these two arteries, right? You have the Circle of Willis, and then you have a bunch of arteries that extend outward that supply both hemispheres of the brain with blood. And so you have the anterior artery, you have the anterior communicating artery, you have the medial artery, and you have the posterior and the posterior communicating artery. So what they do is they receive blood from the carotid arteries, and they send blood all throughout the brain. And so you got to understand that the Circle of Willis is located it encirculates the pituitary gland, the main trunk of the hypothalamus, and the optic chiasm, which is where the optic nerve crosses. So that's where the Circle of Willis is located. And what it's doing is it's circulating blood, and it's got many outlets. So as the blood perfuses upward, it can perfuse the entire brain, both hemispheres, and it can communicate with both of them as well by sending blood from one area to the other via that communicating artery that it contains. And so the issue with the Circle of Willis is that sometimes when you have atherosclerotic plaques, like in the carotid arteries or in the actual Circle of Willis, it can lead to TIAs, transient ischemic attacks, or it could also lead to strokes, cerebral vascular accidents. And so the lower in the anatomy you have the atherosclerotic plaque and blockage, it's going to increase the pathology of the condition because you have like a base or a root segment of the artery that's being obstructed. So therefore, all of the structures above it won't be receiving any perfusion. But anyway, that's why the Circle of Willis is very important, because it provides circulation to the entire brain, both hemispheres. And I hope that kind of makes sense, Mama.
All right, thanks.